I'm Dr. Rafael Bustamante, a board-certified vascular and endovascular surgeon. So vascular surgery is the study of diseases in the arteries, excluding the heart and the brain. So my field entitles diseases in the arteries in the arms, the legs, the belly that goes into the organs. And we work in treating that with open techniques and minimally invasive techniques. The reason I fell in love with the specialty is the intricacy of the operations. It's every suture matters, every distance between every suture matters. And you see the results immediately after we finish creating our anastomosis or our bypasses. And you really have a good opportunity to make a difference in the patient's life by saving their limbs or saving their lives when it comes to a ruptured aneurysm cases. The first time consults is basically a lot of the patients are nervous to see a surgeon because they automatically assume that they're going to go under the knife. So the first thing that I want to make patients comfortable is basically having someone for them to listen to their issues, because half the time what the patients will tell you exactly what they're there for, without them knowing. Also is to tell them that we've seen this before and we'll take care of this as much as we can together. At HCA Broward Vascular Surgery, the type of care that patients expect is for them to feel comfortable, for them to have a physician that could relate to them and that is honest with them and honest about expectations, and for them to feel as if they had every question answered. That's my main goal for every patient to come into the office, so they could leave the office without any questions.